Before I begin my remarks, I also want to acknowledge that 9 fellow Nova Scotians have passed away from COVID-19 since we last were here on Friday. All 9 were residents of Northwood, and like the Premier, I want to pass my deep condolences on to their families. Part of that 9 is 3 additional deaths that we are reporting today since yesterday's update. That brings us to a total of 41 Nova Scotians who have unfortunately passed away due to COVID-19. We do have 6 new cases of COVID-19 reported today in the province, which brings our total number of cases to 991. Out of that, we have 6 individuals in hospital, 2 of those in the ICU. So that number it continues to drop, which is encouraging. And they're included in the 652 Nova Scotians who have been infected with COVID-19, but now can be considered to be recovered. We've had 30,984 Nova Scotians who have tested and received a negative result. And in our long-term care settings, we have 11 licensed long-term care homes and an unlicensed seniors facility that have had at least 1 case of COVID-19 in a staff or resident. The total number of residents involved is 245 and 113 staff. And the majority of those are from Northwood. I will give in a moment, I will give a more detailed update on the long-term care situation. The QE2 lab continues to have lots of capacity. Yesterday, we did 454 tests. They can do at least 3 times as much as that. So I really want to, we're continuing to look at, in an evidence-based, organized way, as we move forward into a recovery strategy, how we actually use a detailed active surveillance based on testing to inform that recovery, and we're certainly going to be looking at ways we increase the testing that we do. But we also want to remind any Nova Scotians that who have symptoms that could be COVID. All our assessment centers are still open, and we encourage people to, if they have at least, if they have 2 or more of fever, new or worsening cough, headache, sore throat, or runny nose. If you have those symptoms or have concerns you have COVID, if you're able to use the online assessment tool, please do that. If you don't have that internet access, you can certainly call 811, and they'll give you direction from there. I'll now move into a more detailed update of the numbers we've had in our long-term care homes and the unlicensed seniors facility. Up till now, we have presented cumulative numbers, and as I said just a few moments ago, we've had 11 long-term care homes and unlicensed seniors facilities that have had COVID-19 among staff and or residents. Of the total of 245 residents, 46 of those have recovered, and 39 unfortunately have died. The remainder are still in the recovery process and being cared for within their facility. Of the 113 staff who have contracted COVID-19, 61 can be considered recovered. The rest of them are still within that in the time period of their infection, waiting to reach the minimum of 10 days before they can be considered to be recovered. Fortunately, we have had no staff fatalities among the staff cases. All the active cases that we now have in long-term care facilities are at Northwood in Halifax, and that's a total of 160 residents who are still considered active cases, and 49 staff who are still considered active. We have 2 other licensed long-term care homes and unlicensed seniors facilities that have active cases among staff. There's two individuals in total. So Northwood aside, we've had several outbreaks in long-term care facilities that we've been able to manage, limit the spread, and in other facilities where we have sporadic cases, there hasn't been substantive spread. I think that's testament to, in general, the work that's happened in our long-term care sector and the plans that have been were prepared and put in place. It's important that Nova Scotians understand that as we respond to COVID-19, that our priority has been to protect and maintain the health of Nova Scotians with a particular focus on those who are most vulnerable. And clearly we know, looking at our experience here in Nova Scotia, across the country and internationally, that seniors in long-term care facilities remain at the top of the list of ones who are the most vulnerable for severe disease and dying from COVID-19, and they will remain a particular focus of our attention even as we move into recovery. Protecting those individuals is a top priority. We do know that we've only had the one long-term care facility, Northwood, that it's had a significant outbreak, as I mentioned, and I'll speak to Northwood in more detail in a minute. And again, that's reflected that the protocols, the planning that were put in place have been successful in limiting outbreaks in the smaller type facilities that we have around the province. We know that we're among the first of the provinces that restricted access from visitors to long-term care facilities back in March the 15th. On April 6th, we actually put together a comprehensive set of directives to long-term care facilities based on the prevention steps as well as managing outbreaks. The majority of those steps were already in place and were built on existing protocols in place for influenza, but we went a step further, and rather than as guidance, we actually made them directives and then supported long-term care facilities in the necessary and needed implementation of those directives. But ahead of those directives, we know that many of the facilities had already been proactive on their own. For example, Northwood required staff to start wearing surgical masks in all patient interactions on April the 6th, and that was actually 2 days ahead of the Public Health Agency issuing their guidance on the use of masks by frontline healthcare providers. We in turn, Nova Scotia, we were doing an assessment on the supply of personal protective equipment, and that we gave an official directive to long-term care facilities, along with other care providers in hospitals. But for the long-term care facilities, it was a directive on April 13th that they were all frontline care providers wear masks. And even prior to April 13th, we had spent the 2 days prior to that, we were actually distributing masks to long-term care, beginning on April the 11th. On April 23rd, we put forward as part of our revised directive that staff that were working in a facility that had an active outbreak would not be able to go work in another facility without self-isolating for 14 days. And that was an important step as well. And we will continue to review those implications. We're looking at our potential requirement for long-term care staff to only work in one facility. We're looking at there are significant implications for that, and we continue to look at that and whether that's feasible or possible. But we're doing as much as we can to limit the movement of staff between facilities, whether there's an outbreak or not. I think it's important for Nova Scotians to understand, if they look across the country, that what they see happening in Nova Scotia, the timing may be different than what they're seeing in other provinces. And that's simply a reflection that each province has their own epidemiology that we're responding to. Certainly COVID-19 does not happen consistently across the province. And so some of our actions were ahead of other provinces, and some of those were behind. For instance, we know that Ontario, Alberta, and British Columbia were ahead of Nova Scotia in implementing the masking policy, and that is simply a reflection of they were 2 to 3 weeks ahead of the rest of the country in how the pandemic played out within their own jurisdiction. Nova Scotia, we were fortunate. We were the last province to have a confirmed case of COVID-19, and so we were further behind. But we implemented the FACT masking policy ahead of Saskatchewan, Manitoba, New Brunswick, and PEI. It's also important to understand that our first cases of COVID-19 in long-term care facilities began in late March, and because of the time frame of exposure, that these individuals would actually have been infected in the 1 to 2 weeks prior to that, so around the middle of March, and that again was well ahead of the evolving science around asymptomatic spread, and well ahead of the national guidance that was issued again on April 18th around masking. We know that in an epidemic like this, knowledge evolves. We build our response based on the best available information in front of us at the time. As evidence evolves and science evolves, we adjust our response. But we can't anticipate where science may go, and we have to respond on an evidence-based approach of what's in the knowledge that's in front of us at the time. We want to reassure Nova Scotians that we, with a lot of hard work led by Deputy Minister Fred Crooks, working across government, working with many business sectors, that we now have a good supply of PPE for healthcare and essential service workers, including masks, and we're involved in ongoing conversations to make sure with our long-term care facilities to make sure that they have the appropriate amount of PPE that they require as we move forward in our COVID-19 response. I'll end up by speaking specifically a little bit around Northwood. And there's no question at all that around the tragic and very serious situation at Northwood. But I want Nova Scotians to know that Northwood and the healthcare system and the provincial government that all appropriate steps have been taken to bring that situation under control. Northwood, in the Nova Scotia context, is a very unique facility. It is by far the largest long-term care facility in the province. It's the largest facility east of Montreal. It has almost 600 residents and 400 staff. Many of the residents there are very frail and elderly, like other long-term care facilities, but making them very vulnerable to the virus. Much of the Northwood building, because of the age that it was built, does consist of shared rooms, and which makes people more the ability for virus to be transmitted. That's just a reality of the infrastructure we have. There are also, by the size of the facility, the 400 staff living in an urban environment. As I've talked previously, urban environments, we have greater likelihood of the transmission of and the spread of COVID-19. So we have large numbers of staff coming from a number of communities across HRM, and some of them their job by necessity has them traveling throughout the facility. So all those conditions make Northwood somewhat unique in the Nova Scotia context, and made it the opportunity, unfortunately, that once COVID-19 was introduced, it was able to spread significantly throughout Northwood before any cases were detected and before we even were aware that there was an outbreak going on. But I have to give Northwood credit. They have taken all the steps that they could have taken in preparation. In fact, they implemented their pandemic plan back in March the 12th. And as I also mentioned, they were one of the first in the province, even before a directive on April 6th, where they started to require all their workers providing care to wear masks. The first cases at Northwood were detected. The first the first staff was on April the 5th, and they had their first 5 residents detected on April the 7th. They were immediately supported by Nova Scotia Health Authority Public Health, as we do with all long-term care outbreaks. And there was initially felt that the outbreak was able to be managed appropriately. But on April 17th, they understood that they were becoming overwhelmed, and they reached out to the Department of Health and Wellness for help. And there was an immediate response from the rest of the health system and across government to put in the necessary supports to be able to develop and implement the emergency plan that was necessary. We had the Nova Scotia Health Authority, other long-term care facility partners, educational partners, continuing care assistance and training, all who came together quickly to support the necessary staffing needs. The Nova Scotia Health Authority brought in 2 infection control experts to complement what was already in place at Northwood. And I think it's important to recognize that there has always been an appropriate and sufficient supply of the necessary personal protective equipment, masks, gowns, etc., to manage this outbreak at Northwood. So I think we recognize the tremendous efforts that have happened, and like the Premier, want to pass on my thanks to all the workers from a range within Northwood and all the health system partners who have come to their aid, and the unions and other groups. I want to thank all of them for the collaborative effort that's been put in to do what's necessary and what can be done in Northwood to manage this outbreak. The appropriate protocols were being followed, continue to be followed, and we'll continue to support Northwood as necessary. We are still doing some testing in that facility. The number of cases are decreasing as we'd expected, but we will see some more cases coming over time. It's simply a fact that it takes time for some individuals from the time they were exposed. And one of the things we're learning about this virus in many of the residents, if they initially test negative, that we already know that they've actually been infected, and we can expect that they will in the days to come test positive. Northwood has been taking the appropriate steps that as best they can within their facility to isolate positives from negatives. We're now in the process of being able to move more people resolved out of the facility, and now Northwood has created a unit within their space for people who have resolved them, which is giving more flexibility to that facility to separate people who are known positives from the rest of the population. But it's unfortunate because of what we now know about asymptomatic spread, which wasn't as well recognized and understood even a month ago or 6 weeks ago, that the virus had gained a foothold in that facility, and that the preparedness steps that were taken was necessary and appropriate. We've been able to do what can be done to minimize the impact of the virus in a facility, given the unique circumstances of Northwood. So we have to remember this has been going on for 6 weeks. Many of the residents had already been exposed by the time we actually recognized the outbreak, and it can take some time for them to go on and develop illness. Some of them, unfortunately, many of them are doing well and are recovering, but we do know that many of these residents are very frail with multiple underlying health conditions, and some of them will continue to get more serious disease. But I think we thought it was important. I want the Nova Scotians to understand that all available steps were taken in preparedness by Northwood. The initial response by Northwood was entirely appropriate based on best practice around long-term care, infection control, and outbreak management. And then the appropriate steps were taken when the health system response stepped in to support Northwood as necessary. It's tragic. It breaks my heart when I see the numbers every day, but and I really feel for families and individuals. But I want Nova Scotians to understand that the healthcare system has and will continue to take this circumstance very seriously and do what's necessary and what can be done to support Northwood.